Warm welcome to the latest OncoShorts podcast, brought to you by MedSynapse. OncoShorts is a weekly program covering a wide range of clinical and scientific medical content that offers enriching insights into the world of oncology. In today's podcast episode, we will discuss details of the CheckMate 9LA study, titled First Line Nivolumab plus Ipilimumab combined with 2 cycles of chemotherapy, in patients with non-small cell lung cancer, an international, randomized, open-label, phase 3 trial, published on 18th January 2021, and featured in January 2021 issue of the Lancet Oncology. Now, we all know the severity experienced in managing advanced non-small cell lung cancer. Although the initial stage is curable with a simple surgery, most of the cases are identified after the progression to an advanced stage of cancer. With the need for effective treatment in the early stage of cancer, multiple regimens are being studied. Among these, Nivolumab has been studied extensively as the first-line treatment for patients without driver mutations. Nivolumab is a fully human anti-PD-1 antibody, and Ipilimumab is an anti-cytotoxic T lymphocyte antigen 4 antibody. Both are immune checkpoint inhibitors and have complementary actions in the human body. Thus, combination therapy with Nivolumab plus Ipilimumab has resulted in longer overall survival than previous standard therapies in patients with melanoma and those with renal cell carcinoma. Previously, in the study termed CheckMate 227, a combination of Nivolumab and Ipilimumab with chemotherapy had been addressed for PD-L1 expression less than 1% and greater than 1%. The efficiency of Nivolumab and Ipilimumab was higher compared to Nivolumab-only therapy. These studies also reported that effective treatment for tumors with PD-L1 expression would increase the overall survival rate and duration of response. Since then, studies for using this combination therapy against non-small cell lung cancer are in clinical trials. The study presented in this podcast is based on these fundamentals and could go a long way as a potential solution in effective treatment of non-small cell lung cancer. In the study, termed CheckMate 9LA, an international, randomized, open-label, phase 3 trial was done in 103 hospitals and 19 countries. Eligible patients had stage 4 squamous or non-squamous or recurrent non-small cell lung cancer. Patient with performance status of 0 to 1 on the Eastern Cooperative Oncology Group and no previous systemic anti-cancer therapy as primary treatment for advanced or metastatic disease were chosen. And most importantly, all the patients had to have tumor tissue available to assess PD-L1 expression levels at start of the study. In the open-label study, conducted between 24th of August 2017 and 30th of January 2019, patients were randomly assigned Nivolumab plus Ipilimumab with chemotherapy, or chemotherapy alone. Randomization was done using permuted block randomization, using 4 blocks, with stratum defined by tumor histology. The group was also divided between tumor PD-L1 expression levels, that is, less than 1% and greater than 1%. Patients without perfect assessment of PD-L1 were stratified in less than 1% group. Out of 1,150 patients enrolled, 719 patients were in the experimental group, assigned Nivolumab plus Ipilimumab with 2 cycles of chemotherapy, or 4 cycles of chemotherapy for control group. At a median follow-up at 9.7 months, the overall survival rate was higher in the experimental group. The experimental group reported 14.1 month survival rate against the control's 10.7 months, with 95% confidence interval at 13.2 to 16.2 versus 9.5 to 12.4 for experimental and control groups respectively. After conducting a 3.5-month-long median follow-up, median overall survival was 15.6 months in the experimental group versus 10.9 months in the control group. A 95% confidence interval ranged between 13.9 to 20 versus 9.5 to 12.6 respectively. In the study, 7 participants in the experimental group and 6 participants in the control group experienced treatment-related deaths. Shortcomings in the study, due to varied existing medical conditions in patient populations and study designs, should be considered during cross-trial comparison. The inability of therapy durability assessment during database lock, and the use of chemotherapy instead of advanced regimens was also noted. Based on the above discussion, we can conclude that the study did prove a high benefit-risk ratio for first-line treatment with Nivolumab and Ipilimumab, with 2 cycles of chemotherapy for non-small cell lung cancer. Extended overall survival rate compared to classical chemotherapy regimen proves that further advancements with this regimen could benefit patients with advanced non-small cell lung cancer. This concludes our today's OncoShorts podcast, brought to you by MedSynapse. Thank you for listening.